Welcome to our program on the future of vaccines, innovations, and challenges. In this 15-minute video, we'll explore the latest advancement in vaccine technology, the challenges in vaccine development, and their critical role in our public health. As a co-founder of an NGO for healthy promotion, it's our responsibility to educate the people on key messages and action for combating some of the deadliest diseases worldwide.
Hello everyone and welcome. My name is Mohamad Qozek. Today we embark on a journey through the fascinating world of vaccine. Join me as we uncover the breakdown, the hundreds and the promise of safeguarding our health through vaccination. Before we dive into the specifics, let's take a look at the key messages and action we'll be discussing today. What is the history of vaccine? And the second is understand the importance of vaccines and the preventing deadly disease. Stay informed about the latest advancement in the vaccine technology and address common misconceptions and concerns about vaccines. And the last, advocate for equitable access to vaccines for all communities. Our first message is understand the history of vaccine. Can Dr. Rizal explain how the history and evolution of vaccine was created?
Hi, Assalamualaikum and a very good day. I am Dr. Muhammad Rizal bin Zanudin, a resident doctor in KPJ Perdana Specialist Hospital in Kota Baru, Kelantan. Well, thanks for the question. Regarding about the question about the history of vaccination, actually we can trace back the history to about 500 years ago in the Chinese and Indian civilization. And later on 18th century, we got a scientist named Edward Jenner who have made a famous observation where in his observation he found out that a cow milkmaid was not getting a small pox infection. Further on his investigation, Edward Jenner found out that the cow milkmaid was previously infected with a cowpox disease. That is a starting point from where vaccination starts to make sense and start to grow in the medical field. And historically in Europe, during the World War II, US Army found out a lot of its troops is getting sick from infection. So during the World War II, the US Army start to make a research on infectious disease while there are on war in Europe, and that is also a turning point for vaccination history. And as some additional information, as a progression from Edward Jenner observation, scientists since then have developed a various number of vaccines against infectious disease such as polio, measles, mumps, rubella, influenza, and among others. That is a bit about vaccination history. Thank you.
Thank you, Dr. Rizal. Now we must know to understand the importance of vaccines and the preventing deadly disease. The importance of vaccines in preventing deadly disease. Vaccines are one of the most effective tools we have in our public health. They have eradicated smallpox, significantly reduced cases of polio, and preventing countless deaths from diseases like measles, tetanus, and influenza. Can Mohamad Shafiq explain it?
Hello, hi, Assalamualaikum everyone. Thank you to the moderator and organizer committee for inviting me into this wonderful conference, The Future of Vaccine, Innovation and Challenge. I guess this is the best platform to share the knowledge, especially to educate public about health. I'm Mohamad Shafiq bin Saad, specialist in infectious disease, and today I would like to share about the importance of vaccine and how it works. So just now, we just had a section sharing about how vaccine started. So I hope we can get a rough idea how and what actually vaccine it is. Okay, so basically, vaccine play a crucial role in preventing morbidity and mortality in our community from deadly disease. Okay, so I will try my best to simplify as I could so that we can understand better together. And if you guys have any question in the middle of my session, you can stop me anytime and ask the question. Okay, alright. So, the vaccine is an active part of that particular microorganism. We call it antigen that trigger an immune response within our body after we inject it into our body, and this will create antibodies to fight those pathogens and creating memory response. So the next time, if someone or individual get infected by the actual pathogen, our body already have the defense system, and this will prevent from a severity of the disease. We call it as immunization. This immunization not only protect individual but also a part of community, or known as herd immunity. That's why if we still remember back in 2020, our pandemic scenario of COVID-19, people globally were encouraged to take a vaccine in order to build this immunity and preventing from uncontrolled or widespreading of severity of the disease of COVID-19. Moreover, there are billions of journals and been eradicating shown that vaccine help from smallpox, polio, rubella, influenza and so on. Vaccine help the world save millions of lives from long complication, disability and death especially. In other words, helping economic burden in certain country. So as a conclusion, vaccine still remain as the most effective and efficient in public health intervention. So please create awareness and spread the benefit of vaccine to the public. Till that, thank you for your time and have a good day. Assalamualaikum.
Our next message focuses on staying informed about the latest advancement in vaccine technology. Can Mirutu explain it?
Good afternoon, I'm Miruthubashini Varmma Manogaran, and my matrix number is JP10771119. So today I'm going to talk about staying informed about the latest advancement in vaccine technology. First of all, thank you to the host to shooting questions like this. And as an immunologist, staying informed about the latest advancement in vaccine technology is essential to ensure that individuals, healthcare professionals, and policymakers can informed decision about the vaccine strategies and public health initiative too. The field of vaccine development is constantly evolving, with research continually exploring new technologies and innovative approach to enhance vaccine efficacy, safety, and accessibility. For example, recent breakout in mRNA vaccine technology have revolutionized the way we develop vaccine, as seen with the rapid development of COVID-19 vaccine. mRNA vaccine offers several advantages, including faster production, accessibility, and the potential for targeting a wide range of infection diseases, making them a promising tool for combating emerging threats and pandemics. Additionally, staying abreast of advancement in vaccine technology allow for the identification and adoption of novel vaccine platforms and delivery methods that can overcome existing challenge and limitation. For instance, research are investigating the use of novel adjustments such as nanoparticles and virus-like particles to enhance immune response and reduce the number of vaccine doses required for long-lasting protection. Furthermore, advancement in vaccine manufacturing technologies such as cell-based and recombinant vaccine production hold the potential to improve vaccine supply chains, reduce costs, and ensure equity access to vaccine worldwide. By staying informed and embrace them in meditation, we can continue to strengthen our defense against the infection disease, safeguard public on global scale. So this is my explanation regarding how we want to stay focused in advancement in vaccine. So again, thank you to the host to inviting me for such a huge interview. And last but not least, thanks to everyone. Take care. Goodbye.
Thank you, Mirutu. Very interesting explanation. As you can see, vaccines have evolved over time, becoming safer, more effective, and easier to produce. Take for the example the revolution mRNA vaccines, which have demonstrated incredible efficacy against COVID-19 in a record time. Now, let's address common misconceptions and concerns about vaccines. It's essential to acknowledge and address this to build trust and confidence in vaccination efforts. Can SHAHRULRIZAL explain it?
Assalamualaikum and hi everyone. My name is Dr. Mohamad SHAHRULRIZAL bin MUSA. I am from Queen Mary Medical College. I am a professor in the field of epidemics. I am very proud to have been invited to give a talk today. Addressing common misconception and concern about vaccine is crucial for building trust and confidence in vaccination effort. One prevalent misconception is the notion that vaccines cause autism. However, numerous scientific studies have truly debunked this claim, and major health organizations worldwide, including Center for Disease Control and Prevention and the World Health Organization, affirm that there is no link between vaccine and autism. It is important to emphasize the overwhelming scientific consensus on this matter and provide factual information to counter misinformation and reassure the public about the safety of vaccines. Another common concern revolves around vaccine safety, particularly regarding potential adverse reaction. While all medical intervention carry some level of risk, vaccines undergo rigorous testing and monitoring to ensure the safety and efficiency before being approved for us. Systems like the Vaccine Adverse Event Reporting System in the United States continuously monitoring and investigate adverse events following vaccination, allowing to prompt identification and respond to any safety concern by transparently communicating the extensively safety measure in place and addressing concern with evidence-based information. We can help alleviate anxieties and promote confidence in the safety and effectiveness of vaccine.
Our final message emphasizing advocating for equitable access to vaccines for all communities. Despite the progress we made, millions of people around the world still lack access to life-saving vaccines due to various barriers. Can Mama AZIQ give your opinion?
Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to everyone. Thank you to my host and our beloved panels for inviting me for this session. Okay, based on that question, advocating for equitable access to vaccine or for all communities and imperative to ensure that everyone, regardless of their socio-economic status or geographical location, has the opportunity to benefit from life-saving immunization. Disparities in access to vaccine can exacerbate health inequalities and perpetuate cycle of poverty and disease. Marginalized communities, including those in low-income countries and underserved regions, often face barriers such as limited healthcare infrastructure, lack of awareness, and financial constraints, which hinder their abilities to access vaccine. by advocating for policies and initiatives that prioritize equitable distribution and allocation of vaccine, we can help address this disparity and ensure that no one is left behind. And furthermore, achieving equitable access to vaccine requires a collaborative and multi-sectoral approach involving government, international organizations, pharmaceutical companies, and civil society. Effort should focus on strengthening healthcare system, increasing vaccine production and supply, improving vaccine delivery infrastructure, and addressing social culture barriers that may impede vaccine uptake. Additionally, initiatives such as the COVAX facility, which aim to provide fair and equitable access to COVID-19 vaccine worldwide, serve as a model for global cooperation and solidarity in addressing vaccine inequity. By advocating for sustained investment and commitment for equitable vaccine distribution, we can move closer to achieve health equity and realizing the fundamental right to health for all individuals and communities. Thank you so much.
As you can see, there's a stark disparity in vaccine distributing worldwide. Addressing this requires collective action from NGO, government, and global health organizations to ensure that vaccines reach those who need them most. Okay, in conclusion, vaccines are cornerstone of public health, saving millions of our lives each year. By understanding their importance, staying informed, addressing concerns, and advocating for equitable access, we can ensure a healthier and safer future of all. Thank you for joining us on this journey to the future of vaccines. Together, let's continue to champion vaccination efforts and prioritize our health for a better quality of life. Thank you.